While treatment and cancer-related quality of life for the patient is a top priority for navigation, it is imperative to also assess and address the impact on caregivers. Caregivers have a vital and unique role in helping a person with cancer through their cancer journey. As with any chronic illness, taking care of someone with CLL can be a demanding, stressful, and challenging experience. Caregiving roles and tasks tend to change over time based on patients' conditions and the level of independence needed. The caregiving role expands as a patient becomes sicker, particularly with in-home care delivery and when patients approach the end of their life. Some care transitions are more expected, with emergency department visits being potentially traumatic. Caregivers of acutely ill patients must be present for extended hospital stays, and they must manage adverse events and other complications of toxic treatments over the disease continuum. They can also face significant responsibilities, and due to the chronicity of CLL, they may juggle competing work priorities, financial concerns, and resources such as gas, groceries, and other challenges. All of these must be acknowledged by the navigator, and if possible, supported with solutions. Healthcare providers generally do a poor job of assessing caregivers' needs and must do better to acknowledge these concerns and ultimately address them. Sexuality and intimacy concerns are often overlooked during cancer treatment, especially for caregivers. For example, spouses with CLL may have decreased sex drive, increased fatigue, and lack of desire to engage in activities and caregiver burnout. Navigators should assess for this issue throughout care and provide appropriate referrals to supportive resources if warranted. While we focus on patients and caregivers, we should also shine a light on healthcare professionals, including navigators, who can often experience caregiver burnout and compassion fatigue. Many factors can place navigators at risk of burnout, including the hematologic malignancy disease site and patient workload, which often leads to pouring from an empty cup. Which is why this is crucial for the sustainability of oncology navigation to remember to establish boundaries and practice self-care. Every navigator should work to establish a routine that includes self-care, and that varies per person. Some colleagues of mine prefer to read a book or spend time talking with a close friend or neighbor. We also held a monthly meditation at our cancer center, which was very helpful to reset and recenter. In my opinion, it is key to find what works and just go with it. Search the web for evidence-based resources such as Dr. Catherine Cook-Catone's Mindful Self-Care Scale, which is a validated, standardized tool for assessing the variety and frequency of self-care strategies. Another key strategy is to have team debriefings, which can help decompress from stressful or challenging situations, and this helps the navigation team unpack the day, week, or month and helps decompress stress, leading to a more positive mindset and grounded practice.